Hey, I'm Dr. Kelly Vaughn with First Choice Dental Centers and Restoring 24 Dental Implants. Today we're going to be talking about bone grafting. So what is bone grafting for dental implants? Sometimes before getting a dental implant, a person might need a bone graft. And a bone graft is when the dentist adds extra bone to your jaw to make it a more suitable place to hold the implant. So why might you need a bone graft? After you lose a tooth, the bone in your jaw can shrink or basically melt away, and there may not be enough bone to support a dental implant. A bone graft helps build up the bone so that the implant has a better and more secure foundation. There are basically four main types of bone grafting for implants, and the first one is a simple socket graft or a minor graft. So, what is a simple graft? After a tooth is removed, the dentist may put bone graft material directly into the empty tooth socket where the root used to be, and this is to help prevent further bone loss. It keeps the bone from shrinking so you can get an implant in the near future. But remember, you don't want to wait too long because without the tooth or an implant to stimulate the bone, it will begin to melt away or resorb. So all that new bone that got put in, it's just going to resorb as well. The healing time for a simple socket graft is usually about 3 to 4 months, and that's before the implant can be placed. The second most common type of bone graft is a sinus lift, and this is for the upper jaw. It's needed when there isn't enough bone between your sinus cavity in the upper jaw and where you want to place the implant. If you want to know more about sinus lifts, I'll leave a link for a video specifically about sinus lifts below. So a sinus lift enables an implant to be placed in the upper jaw where it is needed for the best success, and to make sure there's no damage to the sinus during the implant placement. Basically, you're just lifting the sinus up out of the way, putting bone underneath it so the sinus is lifted up higher, and it allows room to place the implant. It takes about 6 months of healing time, and that allows it to fully heal and fill in, and then an implant can be added. The third most common type of bone grafting for dental implants is something called a ridge augmentation. This is needed if your bone is too narrow for a dental implant. The dentist can add bone to make it wider. Sometimes when a tooth is removed and missing for a while, the bone resorbs or melts away, and you can't get the implant in because it's not wide enough to hold the implant. So we'll put a bone graft here, making it wider, building up the width. Then you place a membrane over it to help hold the graft in place. You allow it to heal, and then when you come back, there's enough bone width to place the implant in the desired location. The healing time for a ridge augmentation, it usually takes about 4 to 6 months before the implant can be placed. Now, the fourth type of bone graft is a major graft or a block graft. This one is far more technical than the other ones. This is for people with a lot of bone loss, and you're taking a larger piece of bone from some other part of the body, like the chin or the hip, and you're anchoring it to the bone where you need the bone for the implant. And again, it's called a block bone graft. It rebuilds a big section of missing bone, making it strong enough to accommodate the implant. Now, the healing time for these takes about 6 to 9 months before the implant can be placed. So how do bone grafts affect healing? Bone grafting adds extra time to the healing process because your body needs time to accept the new bone and fill it in with new bone to make it nice and dense. And depending on the type of bone graft, you're going to have to wait anywhere from 3 to 9 months for the graft to heal before a dentist can come in and put an implant. Now, the good news is once the bone is strong enough, you can get your implant, and after that, the healing process for the implant is the same as any other implant, around 3 to 6 months, depending on where it is in the jaw. So while bone grafting might add some time and expense to the process, it does help ensure that your implant is strong, secure, and ready to last a lifetime. So if you find yourself in need of an implant but have to have a bone grafting procedure done beforehand, don't be discouraged. It does add time and cost, but it's going to ensure the long-term success of your implant. I hope you found this video helpful, and I look forward to seeing you again soon.